Thank you for choosing Dr. Robertson for your surgical care. In this short presentation, we'll describe the medications often prescribed for postoperative pain and how we typically recommend their use in achieving a successful postoperative recovery. Dr. Robertson takes a multimodal approach to provide postoperative pain relief while trying to limit the need for narcotics. These methods include surgical efficiency, minimally invasive surgical techniques, the utilization of postoperative cold therapy units, ibuprofen, Tylenol, local anesthetic injections, and nerve blocks, where indicated. For the first 2 days, we recommend that you take 1 prescription-strength ibuprofen every 8 hours. Think of this ibuprofen as a first-line medication to knock down pain. If you need additional pain relief, you can also take Tylenol or any other prescribed pain medications along with the ibuprofen. If you experience any adverse reactions to ibuprofen, please notify us when you arrive at the pre-op area on the day of your surgery. When managing your pain after surgery, remember to take the prescribed hydrocodone and acetaminophen combination as directed. Use it only when needed and don't exceed the recommended dosage. You can take over-the-counter Tylenol, aka acetaminophen, in addition to the ibuprofen if you feel like you just need something additional but aren't quite in need of the hydrocodone. Just keep in mind that the 325 milligrams in this narcotic combination is the same as Tylenol, so adjust your overall Tylenol intake accordingly. The maximum recommended daily dose of Tylenol is 3,000 milligrams. While nausea can be a side effect of narcotics like hydrocodone, it is not considered an allergy and may be managed with the anti-nausea medication described on the next slide. However, if you have a known allergy to hydrocodone, please inform us before the surgery, and we will provide an alternative pain relief option. Finally, anti-inflammatory medications like ibuprofen are thought to have a potentially negative impact on tissue healing with long-term use. Thus the reason that we only give you ibuprofen for 2 days. After that, we recommend weaning onto Tylenol for pain as needed. Tylenol is not an anti-inflammatory medication. Postoperative nausea can be the result of intraoperative anesthesia still in your system or from narcotic usage. While we find this to be a fairly uncommon occurrence, we will prescribe you several pills of promethazine 25 milligrams, just in case. Consume 1 tablet orally every 4 to 6 hours as necessary. If you are among the majority of patients without nausea symptoms, you can discard this medication. Are you a patient who is undergoing hip arthroscopy? If so, I'll get back to you in a second. If not, we wish the rest of you a speedy recovery and hope that this presentation has answered some of your questions. Now back to my hip scope patients. So, you've been prescribed naproxen 500 milligrams for your upcoming hip arthroscopy. Take 1 tablet by mouth twice daily for 14 days to reap its benefits. As a non-steroidal anti-inflammatory medication, it's crucial to follow the given directions. If you are prescribed naproxen, you will not be prescribed ibuprofen. In case you need additional relief, feel free to take Tylenol or your other pain medications alongside naproxen. While it eases pain, its primary role post-surgery is to minimize the risk of excessive bone formation around the hip joint. If you experience any adverse reactions to naproxen, also known as Aleve, don't hesitate to inform us before your surgery. Your well-being is our priority.